I'm T.S. Wiley. I wrote a book called Sex, Lies, and Menopause. Out of my research has come an exciting new idea, a revolutionary approach to replacing hormones for women naturally. It's a system I designed, using plant-derived hormones dosed more naturally, just like when you were young. It's called the Wiley Protocol, and it's only available at pharmacies displaying this sign. Thousands of women have turned back the clock. So can you.
A Wiley Protocol is an interesting concept that's been developed and actually has brought forth several different actual protocols. But what it is a standardized method of administering hormones in a dosage form where the dosage concentration stays constant. But to adjust the amount that the patient receives, you change the amount of volume of drug that you apply. So there's a consistency of concentration, but a variation of amount applied per a calendar. That calendar follows the cycle and a rhythm of an individual's monthly rhythms of their various hormones. Because of the concentration that we use, we know that these chemicals go transdermally. They become effective. We monitor our patients both by symptomology evaluation and by serum levels on a routine basis. So we know that we get therapeutic effect without getting supraphysiologic levels. So we know that we're balancing, we know that we're doing no harm, and we also know that the patient gets a positive outcome and a definite increase in their quality of life. All of our pharmacies follow a standardized procedure for packaging. Each of the packages, each of the protocols has their own packaging. Each of them has their own calendars. Each of them have their own patient package inserts. And so that helps us, and it also helps the patient, so that the patient knows when they're reaching for one bag which drug they're getting because of colors, because of coatings, because of things like that. And so that helps a lot in the safety of it. We all follow the same procedures for making it. We buy all of our chemicals from the same sources. We all follow the same procedures for compounding it. And we also all follow quality assurance programs. We have several components to our quality assurance program. One of the biggest part is the fact that we make small batches. Unlike people that make huge batches and that can service very many patients at one time, the batch size we use is never greater than for 10 patients. What that does is gives us a very good quality control so that if there ever is a problem, then we only have to notify 10 patients rather than 100, so our chances of getting results from that are much higher. We also require each of our pharmacies to submit samples to an outside quality assurance lab to make sure that there is the exact amount in the syringes and in the doses as is on the label. This is not always done. Most other compounders don't necessarily do that. There's a variety of benefits to the pharmacist for participating in the Wiley protocols. One of them is the fact that you develop a large number of clinical skills and you do help your patients. The outcomes that you get are almost always positive, and if there are ever any problems, if you work with your patient and your prescribers, then you can work to solve those problems. And what we get are very happy, very safe, very controlled patients with good outcomes and very few adverse effects. Also, the pharmacist can participate with other pharmacies, reminding everybody that we have a multitude of pharmacies throughout the United States, some in Canada and in Australia, and we're breaking ground in Europe. So these wide number of pharmacies actually can help each other if there's problems, if there's shortages, if somebody needs something that another pharmacy has excess from, and we all work that way. We also have a newsletter that goes to all of the pharmacies that participate that give timely topics and information just to let them know what's going on at the Wiley Protocol group and how we're doing. So there's a variety of different things, and basically there is good remuneration. If you develop a large enough patient base, you will be getting some good financial rewards. The Wiley Protocol is not difficult to use, but because it does follow calendars and cycles, at times patients need some guidance. Also because we can adjust the dosages to make sure that either symptoms go away or adverse effects don't occur, then the pharmacist actively participates with the patient and with the prescriber to make sure that they can adjust those. The dosages are either timing or perhaps there are a lot of different clinical methods for adjusting doses. And those are all standardized too. There's almost an algorithmic method to adjusting doses so that the pharmacist is aware of this as well as the prescriber. If you work close with your prescriber and with your patient, then you can suggest changes that can affect either by suggesting them to the patient with the physician's authorization or by suggesting them to the physician so that he or she can adjust the doses. We do training either on-site or via webcam. And if you're not a compounder right now, this is a very good way of getting into compounding. If you want to only have a very few number of compounds, and this is, remember, bioidentical or biomimetic hormone replacement, then this is a very good place to start. You do get a lot of guidance. We're always here to support you. You have us PRN either by phone, by email, however you want us, but you've got the whole group here to help you go through this. And we will train you as much training as you need until you get it right and so that your standards are up to the Wiley Protocol standards.